Greetings, listeners, and welcome to the Care Table podcast, dedicated to educating and supporting family caregivers of aging loved ones. I'm your host, Amy Huddleston. Through insightful interviews from both industry experts and family caregivers, we aim to provide valuable perspectives and resources. Let's see who we're learning from today. Hi, I'm so excited that we're going to talk all things physical therapy today with Dr. Diane Fleming. Thank you so much for joining us. And I would love for you to just start, Diane, with just giving us an overview about who you are and what your expertise is before we get into all things physical therapy.
Yes, thank you, Amy, for having me here. My name is Diane Fleming. I've been a physical therapist since 2009. I went to St. Francis University, a little school in Pennsylvania, got my bachelor's and then a doctorate in physical therapy in that same school. I started in outpatient orthopedics, ended up in doing skilled nursing for a while, just started as PRN and then took that on full time, loved it. And then kind of came back to outpatient orthopedics, still incorporating a lot of the geriatrics that I got from the skilled nursing setting. And that brings me to where we are today now. What is it, 17 years out?
Gosh, I have to ask before we start this, because I'm just fascinated that that's your expertise is geriatrics.
Yeah.
So it sounds like you started in skilled nursing facilities, but what made you realize that's your passion?
Yeah. If you would have told my younger self while I was in PC school that I would have gone the geriatrics route, I would have said, you're nuts. And I think, having my own journey in physical therapy started when I tore my ACL in high school throwing the javelin. And I think that's like rite of passage to becoming a PT. I think everybody has to tear their ACL first. But I saw.
I don't know if it's done though by throwing the javelin.
No,
That's
that's a
impressive,
unique one
girl.
for sure. But I watched a lot of people while I was in my own therapy. I saw them come in and get better and thought, wow, what a beautiful thing to just get better with movement, not medicine. And, that really, a PT was born in that amount of time. And so I thought, I was a young athlete. I thought when I graduate, I'm going to work with young athletes. And I got into the field, I'm a little over a year in. I was living with my sister at the time, right out of school. So starting to try to make a little more money to get my own apartment, buy a car, things like that. I took on a PRN position in skilled nursing. And
tell people what PRN
yes,
means.
PRN just means as needed. They almost like a contract work. They call you if somebody calls off or if they need a little help on the weekends. Because in a skilled nursing facility setting, there's therapy 7 days a week. So if they need some weekend coverage, a PRN person would come in to cover for that. But that's how I got introduced to it. And then, just looking for various positions. One location I looked at ended up having a position open. And I thought, let's take a jump. Let's just see what this looks like. And it was a big shift because I hadn't really done that setting in school. Where I went, you did 5 clinical rotations, and I had like a neuro one where I did all the balance and vestibular. I did a hospital, outpatient orthopedics, another like mixed hospital progressive care center type, very similar to like nursing, but I hadn't actually been in a facility. And gosh, I loved it more than I ever thought I could have. But in that setting, what really made me go towards the board certification. Now you can get board certified doing a residency, which is like a year-long program, or you can do a self-study, which is the route I went. So I was about 7 years into my career at that point when I decided this is it, this is the move I'm going to make. And it mostly came from the care that I was seeing, knowing that this population deserved more than what they were getting. And I knew that I could be the one to provide that. And I knew that I could make the clinicians around me level up to that, because what I saw wasn't enough. That for people to be shocked that I laid someone on their stomach. Like, why was this groundbreaking? You know what I mean? Everybody should lay on their stomach. How else are we going to get fully extended? I just thought, oh, I've got to dig more into this. And then it just kind of rolled into the sitting for the board certification exam, and here I am.
I think that's an amazing story
Yeah.
that it's and I know we're talking about physical therapy, but I'll just briefly share that I never thought I would work with seniors
Yeah.
or, geriatrics either. It's not what I studied in school or anything. And if you would have told my younger self, I would have said, no way. And then got into a business doing home care to take care of them and had no idea how incredible these people are and the history that they have and the wisdom that they have. And also just I don't know, the feeling that you could get from creating independence for them and a better quality
Mm,
of life. I don't think there's a better profession. So I love your story that it is not where you thought you were
yeah,
going, but it's definitely, I think, where you were meant to
for
be.
sure.
So that's so good.
Yeah.
So let's start with just like explaining what is physical therapy.
Yeah, physical therapy, physical therapists, we call ourselves movement experts. We know every nook, cranny, bump on the bone that there are. We know where those muscles attach, those nerves run through, the blood flows from. We are there to make movement better. And whether that be a goal of getting independent with something, a goal of moving something better, of decreasing pain, again, like you said, increasing independence, that's what physical therapy does. It corrects movement and where there's a fault or a flaw.
So that and I guess what I would ask too is like it's a lot of school, isn't it? I don't think people realize how
Yeah,
much schooling it
I don't
is.
think I realized it first either, but yeah, I mean, but
Oops.
I'll tell you, I truly feel like everything that I learned in school, I don't feel like any of it goes to waste, and boy, am I grateful for that. And because I mean, as much as there is to know, um, there's a little bit pulled in from each section of that every day, but you do get your undergraduate degree. A lot of people get it in something exercise based, exercise science, athletic training, biology, something like that. And then it's another 3 continuous years of physical therapy school after that. Around the year, I want to say 20, no, long before that, I want to say 2003-ish, the program kind of converted. So it started as a bachelor's program. It converted in around that 2003-ish from, it started to, some schools did, transferring from that master's level to a doctorate program. And as of now, it is all doctoral level across the nation.
So it's a lot. I mean, I think
It is,
that's something
yeah.
for people to understand. So
Mhm.
clearly, the
For
body, which
sure.
is, something people need to understand. So
Absolutely.
in addition though to like the movement, I don't think people fully understand all the things you could, do to help somebody in addition to the exercises.
Yes, yeah,
So can you share a little bit about that?
sure. Physical therapists have a huge role in like full quality of life, really. It can be something, orthopedic in terms of fracture recovery, but it can be something as just, you got sick with pneumonia and now you're weak and you just need some reconditioning. You might have urinary incontinence, and physical therapists, there's a whole realm of pelvic health physical therapy that does specifically that. Um, if you notice that someone's falling, there's a whole vestibular certification you can get with the balance system, dizziness, things like that. So it's not just your skeleton, it is the full gamut.
That's so
Yeah.
interesting. Okay, so and the other thing I was going to ask is about and correct me if I'm wrong, but I feel like you would be the ones that are the best to say if I have a concern, like for instance, my dad, I'm going to share, he's getting a little unsteady.
Mm,
He hurt his back. He was going to physical therapy. And I said, Dad, you should ask that physical therapist for possibly a cane recommendation.
sure,
So
sure.
and is that something you feel like you're a good resource for those types of equipment?
100%. And really, I feel when you get to be an older age and those, over age 65, the risk of falls just kind of grows and grows, especially as like activity decreases, likelihood of falls increases, and they can be pretty devastating for, 9 months of your life. Your quality of life is kind of taken. So a physical therapist is absolutely the perfect person to ask for that, for how to use it, how to size it, when to use it. If, deciding between a cane or a walker, even like going as far as like wheelchair positioning and seating. Physical therapists are responsible for all of that. They can help order equipment, and varying depending on states. Even some states now can even give you a handicap placard. from
My
the
gosh.
patient.
Okay. So I want to go back to asking, so I could say to you, if you were helping, for instance, my dad, and I said, I think a cane would be good.
Yeah.
Can you help me order that for him, you're
Yeah,
saying?
so there's, a lot of time, insurance is insurance, right? And so, especially, let's just go with Medicare because that's the typical insurance of this demographic. Medicare will pay for either a walker or a wheelchair, I think every 5 years. So we can like help with ordering that. Sometimes it can just be as easy as getting a prescription from the doctor and going to like a health mart or a medical sales supply place.
Hmm.
Um, Again, if you go through insurance, like definitely for the wheelchair, I would do that to get that covered. But sometimes it's just a little cheaper even to just go to a pharmacy, even like Meyer or a CVS. A lot of times can have some of that equipment there that you can just pick one up
Hmm.
there. A little quicker.
Okay, but
Get you there
it's
quicker.
great that you're the ones that would be great at recommending,
Yeah,
because I mean it's even as specific as if you just look on a cane, there's a lot of different canes.
right,
There are four-prong
right.
canes. There are, I mean,
Single
so I think
point.
that is helpful for people to understand that if you're looking for some
Yeah,
direction and advice for their loved one on what kind of equipment would be best,
yeah.
a physical therapist is a good person to ask.
Absolutely. I mean, and there's so many more probably pieces of equipment that we know about that you might not even, be aware of, just depending on the person's diagnosis. Like, let's say if somebody maybe had a stroke and they're weak on one side, they're still able to walk, but maybe not cane level. There's something called a hemi walker that you can use one sided. And you talked about that 4-prong cane. It's a little wider base, but it's just on one side. It's like I said, hemi walker, one sided walker, but it will let you advance that one side with a little more support than a cane, but takes into account that paralyzed or weak arm. Say something like a pivot, what's called a pivot disc. Let's say this is, I feel like, a great piece of equipment. You're a caregiver for your parents and they can stand okay, but that like taking those steps to walk is tough. Or let's say they're non-weight bearing on one side, that's always tricky. There's a disc that you can stand on that's two pieces. So they stand on that top piece and it just spins like that. So they can stand up from the toilet, spin, and then sit down on a wheelchair. And like it's just, we know a lot of information. It can make it as easier on the caregiver as just as well as the person getting treated. Mhm.
Okay, that's incredibly
Yeah.
helpful.
Very good.
Okay. So I want to talk about, and I know you probably have a zillion examples, but let's talk for a minute about how can physical therapy improve the quality of life of someone being cared for at home.
For sure. I think more than anything, just having the independence, not having to wait to take yourself to the bathroom, like maintaining that dignity of like self care. Um, I mentioned incontinence before, and it might not just be that you can't hold it. Maybe it just takes you several attempts to stand and you can't walk fast enough to get to the toilet and you just can't hold it. If we can get you walking quicker, if we can get you stronger to stand up on that first attempt, then it's not really like an urge incontinence type thing. It's just a functional thing that you just can't move fast enough. Um, making sure that you can stand long enough to cook yourself a meal, stand to get yourself wiped, strong enough to roll in and out of bed. There's a lot of different maneuvers and tricks and, again, equipment, things that we can inform you and the caregiver on just to make a little bit more difference in keeping yourself independent, active, um, just maintain that good quality of life knowing that you've got some agency over your own body.
I'd love to know, out of all the people that you care for, especially in this age group,
Yeah.
what is it that you hear the most from them?
Ooh, that's a good question. Um, and that maybe that depends on setting too. Um, I I would say like the general just achiness of just movement, or like people not wanting to move because it's difficult, but everything can be modified. So I think if you can find something that you enjoy, that can be so life-giving, life-changing to um, promote, promote that like healthy living. If you can find something that you really want to get up and do through the day, that can really keep you motivated.
So is that something you do you figure out how to make it personal for
Always,
every
yeah. I
patient?
tell, I
Oh,
start
I
every
love
session that I have with what would make the session most meaningful for you. And whether that be, um, you know, a pain that they have, but I usually try to guide it more towards an activity. If they say, I couldn't get down to the floor to like play with my grandchild, we're going on the floor today. and that's what we will, and that's what we'll work on. And if we can't get all the way down, maybe we'll go to take a knee, maybe like stacked up like on a couple pillows or something like that. But we'll work our way down. And if some same with you, as much as you want to prevent falls, they happen. I think being able to get yourself up, stands there no trauma that accompanies it, but to be able to get yourself up to maybe get help if you need it, pretty critical. So
love though that that's how you start each
yeah, yeah,
session. I mean, talk about making it personal
yeah,
for them of what, because everybody's answer is going to be
yeah,
different. What is so important to them? Maybe they want to get outside to fill their bird feeders,
yeah,
or
exactly.
like you said, play with the grandchildren on the ground. And everybody's going to be
I
different. And
tell
so I love that
in
you
the field of physical therapy, nobody has physical therapy because something good has happened. It's either an injury or illness. Something has brought this on that they have to do something that they don't really want to do. So may as well make it enjoyable, but not to just
love.
not to just find it something that they want to do. I don't want to say how are you doing, because I don't want them to tell me about pain. I know they're in pain. Not to say I get numb to hearing that, but everybody's in pain. That's why you're there. But what can we, like, for example, arthritis, there's no cure for arthritis. You can offset some of the pain that you're having if you take the load from the joints to the muscles, but I can't fix the damage to the bone that's already done, right? But if I can, so I don't want to ask, how's your pain today? I want to say, how did you get up from the chair? Like, I want to try to tie it to an activity versus like more of, could you get yourself up off the toilet? Were you able to bend over and pull your pants up without getting dizzy? Things like that. I want to know activity. What can you do? Or what can I make easier for you to do?
Love that mindset too, because it's more of the can do and not what you can't do. So you're
Absolutely.
focusing on that, which I think your mindset is a huge part of it, and just helping people work towards something. So when I would ask, I guess, if you have people at home that you're caring for, we do.
Sure.
Um, what signs are we looking for that we feel like, you know what, I think some physical therapy could be helpful here? Because I think that's what people don't realize either, is that it doesn't necessarily need to be that there was a fall or something major
Yeah. Yeah.
happened. So let's talk about what are some signs where maybe a referral for physical therapy would make
Yeah.
sense.
This is, I mean, gosh, where do I begin this list? Uh, like I said, it could be something like you're seeing more incontinence, maybe more incontinent episodes because they're not getting to the bathroom fast enough. You mentioned falls. I'm going to even say weight loss. If somebody is having a hard time just walking themselves to the kitchen or standing to make themselves a meal, they just might not be bypassing that, or just bypassing that whole process. So I would say look for weight loss, or their clothes just, not fitting well. Needing a little more assistance with things like dressing, maybe shortness of breath. Same thing, complaints of dizziness. If there's any new medication changes, it might be worth it too, because gosh, different things can have different effects on, gosh, like statins can affect your muscles and tendons. Blood pressure medications can make position changes a little bit difficult. But I mean, that again is a good reason to have a PT kind of monitor those things, communicate with your family, practitioner, so we can make a plan together.
So that's a great list. Okay, so let's say I do have a concern about that at home, where my dad is starting to lose a little bit of weight. I feel like it's getting harder to get out of the chair. I feel like his gait is a little unsteady. Do I don't believe I can just call the PT office. Do I start with my general practitioner, or, tell me what's the right step to take in order to get the referral?
My first, I guess, suggestion would say, is he safe to go out of the house? Because I would say outpatient therapy is your best bet. If he's not homebound and can get to a physical therapy office, I would say do that. In many states now, physical therapists have direct access, so you don't need a doctor's prescription. The physical therapist will be able to do the evaluation, but they have like 30 days to get a certification from a physician. So, and again, this is not all insurance will allow this, not all states will allow this, but let's say your state does not, just calling your family care, or primary care physician, let them know the circumstances. Sometimes they'll want them to come in, but oftentimes they can just fax a referral over to a physical therapist office of your choice. And you can get scheduled for an initial evaluation where you'll get a whole functional assessment done. And I really, truly,
Okay,
I
so that,
recommend that be done once a year because, kind of get a baseline, and then, then you can always, let's say you get back to your normal and then you start to not feel that great again. You can go back, see where you ended up to where you are now. And then you can say, you're right, you did have a little bit of loss in this area, or whether it be a balance test that we do or a strength test that we do. And then we can kind of revamp your program. And it doesn't necessarily have to be 2 times a week for 8 weeks. Maybe you just need a new home program, maybe something that just needs updated there. You can get a new program, try it yourself. And then if it's working, see you next year. If not, we can pick it back up and start a whole new sequence of care.
that's really helpful. And I did not realize in some states you can just contact the physical therapy,
Yeah.
group,
Mhm.
or I had no
Yeah.
idea you could do that without the
Yeah.
referral.
Mhm. Yep. It's called
So if
direct
you
access, and
were,
many states have it.
oh,
Some, like somebody said, some do not. And like I said, insurance is usually the one that like dictates whether or not they will allow that.
okay. And so if I were looking for a great physical therapist for my loved one, how would you recommend somebody goes about doing that?
Yeah, I would always say word of mouth first. If you know someone who's been in PT and had a good
I agree.
experience, you can't beat someone who's already gone through like a good, uh, round of physical therapy. Um, you know, like I said, you can go online on the APTA, American Physical Therapy Association website, and you can find a board certified specialist in someone in geriatrics. If it's a musculoskeletal thing, you can go in orthopedics, neurology, like I said, pelvic health. So you can go onto there and find a specialist, and I think that's how it's labeled: find a find a or maybe find a provider or find a specialist.
And you said that's
Yeah, APT,
apta.com?
American Physical Therapy Association. Yes.
Okay,
Mhm.
that's a great
Yeah.
resource. So we'll be sure to link to
Yeah.
that.
I think even
Um,
Choose PT, CHOOSE, PT.com also has some good resources there as well to find PTs in your area.
okay, great. So if I and I'm going to ask more for advice on caregivers, I would say,
Sure.
you know, what is your best advice? So I'm even asking on a personal level. I've got in-laws that are 83 and 90, and I've got my parents that are still pretty active. We've tried really hard to get the in-laws a little more active. It's not so easy. What advice do you have for caregivers to be proactive and encouraging your loved ones to stay active?
I think if it's possible to get them into an area where they can be social still, I think that's important. Like going to like a senior center or a recreation center, still get them involved with, people who might be going through the same thing, whether it be a misery loves company situation or if it's just a camaraderie amongst your peers. I think, you know, you, we're, people are not meant to be like all by themselves all the time. So I think if you can find that little core group of people that you at least recognize that you've seen around, maybe find interesting, even if it's something like playing cards, if the family is around, make sure family is visiting, let's say they like playing cards, or find a hobby that they do. Just do it standing up, like play cards, like while you're standing up, make them get on their feet. You know what I mean? Just modify, just
Yes.
find an activity they used to like or still like. And like I said, I think giving company is helpful.
I think that's a
Yeah.
super idea, actually. And I do think the similar group, I had one of the interviews I did was with an orthopedic surgeon who was talking about joint replacement surgery. And I loved what he said because he really prefers people go home and go to a PT
Mhm.
place like where you are, because he said that's therapy in itself,
Mhm.
that you have to get up and get
Right.
dressed and, brush your teeth and like get in the car and you're going to drive to this place. And there's also people in the room, right? I mean, I've been there, and you see these like, I think it's actually a little fun. It's social because everybody's in there exercising. Some people are complaining, but you're laughing and it's just a good
Mhm.
social
Yeah.
activity. So I can see what you're saying about that, of just like you need to have that camaraderie instead
Yeah.
of just like, sitting in a chair by
Isolation
myself at home. It's hard to motivate myself to do
for
some
sure.
exercise. Okay, so I'm gonna work on that, on either playing cards, something, but I think that's great advice. Okay. What about I want to ask on what in is it somebody like you where you're working at an actual building where people are coming to do their physical therapy? You're not working any longer in a skilled nursing facility where people are coming for, let's say, a short-term rehab stay. Do you still do any type of home visits for people where you would suggest modifications or things like that that might make their lives a little bit easier?
So I personally don't do that, but there are agencies that do that. So if we look at, I don't know if you ever go into this in any other episode, but if you look at maybe what Medicare Part A covers versus Medicare Part B covers, like Part A would be like your hospital stay, your long-term care stay. Part B would be your outpatient visits. Now, that being said, there are physical therapists who do what's called mobile, and that they do come to the house. So it'll still be under your Part B benefits, but they will come to the house versus you having to go to a brick and mortar building. So if, let's say, you mentioned your dad or your uncle, let's say they're getting weaker and they're at a spot where they might not be safe for them to come out of the house. It's really risky, and they really don't go anywhere, outside of the home. Someone can come in, same thing, do that PT there, suggest those modifications for you. I mean, really, I think there's a whole system that they can just come to the house, and like you can get all that fit, and they can work with like a carpenter if you need it. Let me try to think if I can. If not, I'll get back to you on what that is called.
That'd be
Yeah,
great because
that
we could put it in the
organization.
show notes.
Hmm.
Because yeah, I know. I mean, I think when people were, at least when I was in working in the
Yeah.
business, I know that when people would go to the skilled nursing facility, a lot of times that physical therapist would come home
Yes.
first, assess the situation to make sure that it was okay and safe for that person to return
Yes.
home,
Hmm.
and maybe make some suggested modifications of what needed to be done. Like there's a shower chair we're going to
Hmm.
need and some grab bars, and maybe if it was a hoarding situation, we've got to make a path for the walker. But I know that it exists for that. So I think people would love that resource to know
Yeah.
if their loved one can't leave and can't come to see a physical therapist
Yeah.
and someone needs to come in, how do they do
Yeah.
that? We can add some notes
For
on
sure.
that. Let's talk for a minute about the different kinds of therapy. So obviously physical therapy is the most popular, but I don't think people are as informed on the other types of like speech therapy, occupational
Yeah.
therapy. Can you touch a little bit about on what those other types are and what they mean,
Sure.
what they
Yeah.
offer?
Two, like I'd say, like very distinct professions, but there's maybe a lot of overlap in some of our like hopes, I guess. So physical therapy, like I said, our goal is like to correct movement, to like functionally retrain how you're moving to make it perfect, right? To do the fine tuning of your movement. Um, Occupational therapy, if you think of occupation, your job is to take care of yourself. And that's, occupational therapy wants to give you the tools, whether it be adaptation or compensation, that you can maintain that independence more with activities that you do in your daily life. Like retrain you on how, like using equipment to get yourself dressed, maybe after you've had a surgery or after you've had a stroke and your arm's not working, or let's say your fingers are numb. There's tools and tips and tricks that they can give you on how to button a shirt again. Um, Pulling up pants, showering, same thing. Can you follow the instructions to cook a meal? Can you load your pills and your medication list? Are you doing that appropriately? So that's a lot more of what occupational therapy, a lot more of the self-care activities of daily living. Like I said, there's some overlap, like with, because same thing, if you're doing something with hands, they might do some strengthening as well. Something that like PT could do. And same, like if you have your hip replaced and if I need to show you how to get your pants on, there's a little bit of overlap there, but that's really their specialty. So there's definitely overlap there. And then now going to speech therapy, there's a little bit of overlap with occupational and speech therapy too. Speech therapy doesn't just do like the phonetics of like how you speak. Let's say like after you have a stroke or something like that, they won't just correct how you're talking. Speech also does swallowing, and they also do a little bit of cognition. So they say again, like same thing with that pill management, like making sure that you're doing that correctly, but they'll also maybe give you like a stack of cards and have you sequence things appropriately. Can you, put that together? Same with, let's say you're nonverbal, they can help you with a communication board or other tools like that that can, or even those tools that can use your eyes to like type out words and things like that. Speech has a part in that. After, you know, I don't know if you ever had to have your esophagus stretched or anything like that. When people have trouble swallowing, they can make modifications to diet, like they can thicken the liquids if it's easier to swallow. They can puree the food, give you like different consistencies, and they can do like electric stimulation down here on the throat muscles to try to like wake those up. Or same with like if you have like a facial nerve palsy, they can hook like electrodes there and get those muscles firing again, just to help with, lip movement after a stroke, if you would have like a little bit of facial droop there. So lots of different things that they're all responsible for. Mhm.
I had no
Yeah.
idea. And then I don't know if you can answer this, but I think my question would be, my understanding, correct me if I'm wrong, is when physical therapy did get prescribed, for instance, and a physical therapist is going to come to the
Mhm.
house and provide PT. My understanding was you couldn't get the occupational therapy just by itself. It had to be with the physical therapy. Do you know if that's the case as far as Medicare?
That I'm not sure about. I wouldn't imagine that be so, because I would think there would have to be some medical necessity to do, you know what I mean? Like, I wouldn't imagine. So let's say if, all of your goals for physical therapy are met, you can do everything except maybe like pull your pants up after getting a shower or something like that. That wouldn't be as much of the role of physical therapy, but I can't imagine that being, not that I've ever heard of that being the case.
So if I think my loved one could benefit from occupational therapy,
Yeah.
is that something I can talk to my physical therapist about?
So you could talk to them about it. So they can't, obviously they can't perform it. It would be under like a different license, but you can, like if they know an occupational therapy group, or if, now I don't know that they have direct access, so you might need to get the prescription for that. So your family physician or if, like a group practice might have more of an insight on agencies that are around that could provide that.
That can do
Yeah.
it. Okay, but that's really helpful to
Mhm.
understand like the
Yeah.
differences and what they can do. I had no idea that the speech therapist can do that
Yeah.
many
Yeah.
skills. So that's great to know. And let's talk for a minute about if I'm having to help my loved one with transferring or getting out of bed, and there's physical, I've definitely need to use my body to help my loved one. What is it that you would say is good advice on body mechanics or that sort of thing, on the best thing to follow? And also, how do you know when it becomes too much for the
Yeah.
caregiver?
So I would say if your loved one is needing assistance with that, I would say for the caregiver to be present during physical therapy, because I will show you what to do. I will teach you the safest mechanics, because it's all for the sake of the patient. So family training, that is all part of what under that umbrella of physical therapy. So I would teach the caregiver how to best safely transfer them off the toilet, out of a chair, out of bed, to keep both of them safe. Um, if to say, like, for an outside person to know when it's too much, that's hard to say. That's got to be a little bit of self-judgment there on if it's, painful versus effort. That's something to like think about. If it's the repetition of it, if you can't hold the proper form, you should not do it. So,
Good
if
advice.
that's the case, then that again would be, the job of the physical therapist to say, how can we do this different? Maybe we need a lift chair. Maybe we need one of those little cushions that has like the spring on it that gives a little bit of lift for the assistance of the caregiver. Um, Maybe that we need to put the chair on risers. There's a lot of different things to try to make that a little bit easier. Um, you know, let's say this was crazy. I had a patient, she was a patient, but her husband, he needed a lot of help at home and he would fall once in a while. And he could get himself up as long as he had something to pull from. So she had shoulder surgery and did a lot of rehab for that. But if he would fall, she would roll him onto a sheet and she would drag the sheet with him on it and he could pull himself up from there. And that's how they did it. And I mean, there was enough like room. It was able to be done. That was her prior level. I would have her doing sled drags just to try to like reproduce that, because if that was their method, then that kept him from having to call the paramedics and he could still get himself up. I'm going to help her with that and make sure
Love
she's
it.
doing it correctly, because if she's going to do it that way, I may as well make sure it's safe.
I love that you also have that mindset. Like, if that's what they want to do, then let me help you make that work where it's safe for you. Instead of saying, don't do that, you need to just call the, EMTs, or if that's what they want to do, and then great. So that's very helpful advice. So you're saying caregiver really can and should be present with you to
Yes.
just see exactly,
Mhm.
okay,
And then
that's really
I almost like test. I'll be like, okay, show me what I did, or or like talk it back to me, because I want to know that you can do it safely and correctly. Because no use in both people being out of commission, right?
That's so great. I would love to know, on another note, when you've got a loved one who is resistant to doing their exercises, for instance. So let's you prescribe them, they, you obviously you show them everything when they're with you, and then you're trusting that when they leave, they're going to do what you've asked them to do.
Yeah,
Is there any magic motivation you have for caregivers to say, this is what I recommend, or here's a success for getting them to
yeah.
actually do what's been prescribed?
That's the toughest part of anything is like home exercise compliance. Um, I what I always tell them, like, let's say they're there for their knee, if they come in and they're like, "Oh, I didn't get to do my exercises," I always say, "I don't care if you don't do your exercises. My knee doesn't hurt." So, but I think if you just remind their goals, like, hey, you wanted to walk down the aisle at your granddaughter's wedding. You know what I mean? If you try to like put it into perspective on like why it matters, like not to not to be threatening about it, like to say like, if you don't do this, I'll put you on a home type of thing. But
Yeah.
just remind them, I want to be able to take care of you. Um, or I want you to be able to stay at my house. I want you to be safe. Try to like make them self-reflect a little bit, which again, that too can be tough if you're dealing with, cognitive issues like dementia or, things like that. That can definitely be tricky. So, and in aspects of that, like when I was in skilled nursing, when I ran into that a little more, it was almost better if you gave them a little task to do. Like, here, can you come over and hold this for me? And then, or can you wipe the wall over here? Or, just try to
Yes.
give them a job. That almost gives them a little bit of purpose.
That's also an exercise, I
Yeah,
bet,
yeah.
right? I mean, you're having
You
them
can put a
move,
little
but they
weight
feel like
around
they're
their arm.
helping, and that's a
Get
super
to
idea.
spin
No,
them.
that's a great idea, actually. So that's good advice. So I think you're just reminding them, this is what you wanted to
Yeah,
work towards. This is the way to do
yeah,
it. So, and is one of the things that you teach really how to safely get up if you do fall?
yeah. Oh, yeah.
Do you?
I've taught people how to
Okay.
fall. I'll lay mats down and teach people how, because they're going to happen. You gotta, I mean, so that being said, that is always done very carefully. But, you know, my first, if my shirt even says I love fall prevention, but my first order of business, I always want people to not fall. It's not a perfect world. People have pets, life happens, people might faint there just so many things can happen. Let's say that you're with it and you catch your toe on something, you can see you're going down, you don't step quite quick enough. Rather than giving yourself a head injury or a broken nose, I want you to land on flat arms, protect your face, protect your head. That's not rule number one, right? Protect the head. I would rather you break your arm than for you to break your skull or to break your nose or to have a brain injury.
Advice.
I mean, you're more less likely to get injured when you land on a full, long, flat surface versus like if you land on your hands and kind of flat. So if you land on long, flat arms all at once, or same if you fall
That's
backwards,
great.
I always, we'll start sitting on the table and we'll just roll, and I'll have them tuck their head in so that they don't whack their head when they're on
With the
back.
head.
So
Okay.
it's a lot of just teaching if it happens. And again, you can't prepare for everything. Your fight or flight's going to take over. Instincts are just going to happen, and you can't plan. But you hope with repetition that muscle memory kicks in when the time comes. But that's. I think a lot of this gets lost sometimes when you're working on balance. I think this is an important point that if you think, people don't like to work on balance because they'll say like, oh, I never had good balance. And I always say you never had good balance. Like when you had to go to first grade and you had to balance on one foot, right?
Ever?
like you never had it. So, and I always say balance has to be hard, like balance exercises. You have to work on it specifically. You can't just do strengthening to improve your balance. You actually have to work on balance itself. So the balance when you're standing still, balance when you're moving, and then balance how you react to something. That I think that gets missed a lot. Like if somebody bumps you in the grocery store, you have to be able to, oh, I need to step to my right. So making those quick movements, we can't lose that speed as we get older. So that is something important too to get addressed.
So I want to go back to you practice the
Yeah.
fall. So now you're down on the ground. Do you practice? Then you teach them, here's how you're going to get up if you're not hurt,
Yes.
obviously.
So usually,
Okay.
so before I even practice the fall, we just practice getting up and down from the floor, like going from standing to putting our hands down low on a chair. And then from there, we'll go into like a half kneeling to a full kneeling to a side sit to laying flat on your back. And that's
Okay.
how we practice just rolling, because rolling's tough. Sometimes that's why people have those bed rails. Sometimes rolling can be tough. So, we work on leg position. We work on just using momentum of our arm, trying to pull our own arm over. There's a lot of different tricks we've got as PTs to try to really re-instruct. Again, if you're not injured and you are able to do that. Now, I wouldn't work on that without somebody there or with somebody skilled to train you how to do that. But that's, people sometimes are resistant to wearing those little life alert necklaces or those fall alert things, or even the watches that have the little fall, monitor.
Oh my goodness. Do you know how many clients that we had over the years that had one of those?
Yeah.
And you would say, well, where is it, Mrs. Smith? Well, it's hanging on my bedside table. Well, that's a great spot for it, right? I mean, it just you I know. So you can't, but I will say I think the watches are great because it's not too intrusive.
Terrible,
It's nothing
right?
hanging from you. Yeah, and they're really it actually I feel like it saved my grandmother
Yeah.
when she was alive because she did fall down the
Yeah.
stairs, and so she was able to call for help.
Yeah.
And they are, I feel, not intrusive. It's not a physical caregiver that's in your house. If you don't want that, it's just a little tool but I'll joke, we got one from my
Yeah.
father-in-law who's
Yeah.
90, and it was a great one actually, where we could see the app on our phone and I could see there was movement, through the night, if he happened to be there by himself and my mother-in-law wasn't there, I could see that he's moving. Well, then I just, I looked at it one day and it wasn't working. So I texted my mother-in-law and said, well, what happened? And she said, we didn't think we needed it. I mean, it's common, right? So I think my advice is if you're not going to use it, I love your advice of, I never realized really that we can go to a physical therapist once a year, just kind of assess where you are. And and figure out what are some exercises you can
Mm-hmm.
do, especially as you're getting
Mm-hmm.
older, because the balance is getting more
Mm-hmm.
challenging. And like you said, we are going to fall.
Mm-hmm.
I hate saying that. I think that
Mm-hmm.
people have this misconception of, well, I'm going to move mom into assisted living and she'll be fine and she's not going to fall. She's going to fall. I mean,
Happens
it
all
just
the time,
happens.
right? Just, I mean, if
Yeah.
you look at diabetics who have numbness in their feet, like sometimes can't feel where they are on the floor, or just, a little bit of confusion too, especially at nighttime if people get the sundowners and they like can't really walk that well, or they forget that they even use a walker and then go without it. It's just, you know, if and when they happen, just to be, like I said, kind of prepare to prevent the injury or to lessen the severity of the injury. And then, like I said, work on getting up. It's a skill you don't want to lose. So if you can do it, try to maintain it, right?
I still keep
Me
practicing
too.
it. I have to
Once a day.
admit. Yeah. Well, I
Yeah,
practice it because I'm like, I just want to be able to get up from the
yeah,
floor. I mean, it's just kind of it's a little bit of a fear that I have because I saw so much over the
that's
years.
good.
So
100%.
I practice it. So, I mean, this was incredible. And I would just ask, for us to close, I'd love for you to share maybe like just one of the most impactful stories that you've had with one of your patients, or something that just like really touched your heart, that you saw a huge change or something they said to you, but just share a
Yeah.
great story with us.
Okay. So what I hope for from all older adults is to not think of themselves as old, or as old being a bad thing. I had a 99-year-old patient who had a shirt on that said 1991 Senior Olympics, and I was like 6 at that time, in 1991. And I thought to myself, what are these Senior Olympics here that you're talking about? And,
Yes.
he told me that he would run the mile and that he used to run 3 miles every single day, but now he was mad because he can only walk two. But I just think that age does not have to be an inhibitor to activity. It doesn't have to be an excuse. But I mean, he got me involved in the Senior Olympics and helping out with that. And just to see so many people really look at age and want to be more still, because your spirit doesn't get old. Maybe your skeleton does, but your spirit doesn't change. And I hope to that I always hope to look for that in all of my older patients, just to see who they feel like when they were 40, 50, because that person's still there, but just know that aging doesn't mean incapable, and that there's still so much life and purpose.
I'm telling you, you found your
Yeah,
calling.
I'm
You
so
you
grateful I'm where I'm at.
I mean, it just everything that you just said, I can tell that you're, and I actually didn't even share this, but the reason I met you is because my aunt was coming for physical therapy. And I have to just tell you personally, she has just raved about you. And I mean, just what, obviously it made such an impact for her that she could go a lot closer places to where she's living. And she said, oh, no, 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 I'm following her. And I see why, because if that's your mindset and that's how you start every session, and that you can see that, that's something I definitely learned over time too, is when you look at people, and I know I feel this way even. I mean, I'm an empty nester now, and I'm so sad thinking, how am I an empty nester? Because in my head I feel like I'm 30. I'm not. But so I can understand that as the older that we
Yeah,
get, you do still feel that way in your
yeah,
mind. And when the body's not quite cooperating, but if you can provide that, just I don't know, you're giving them motivation, and you're also making it so personal to them, and not just feeling like they're just a patient. They're a person.
absolutely. Yeah.
And yeah, you've got a gift. So I am grateful for everything that you shared today.
Yes, and I will look into the home modifications.
That sounds great. We can put that in the podcast notes. And if there's anything else that you think of, you can reach out to me after, and I can certainly add that. But I feel like everything you just shared with us was incredible advice. And people know now, how to connect with a physical therapist, how valuable it is, and how there's a lot of additional, not just the exercises, but there's so much more that you're offering to these patients. So people need to definitely take advantage of it. So, I will continue to encourage my family to do that for sure. So I appreciate it, Diane. It was such a pleasure, and I'm grateful to you. That's a wrap for today's episode of The Care Table. Thank you so much for joining me. If you found this information helpful, would you like, subscribe, write a review, or share this episode with someone that you feel could benefit from hearing this information? I'd sure appreciate it. If you learned of anything during this podcast as far as books, resources, or products that you might think are helpful, be sure to check out the podcast show notes for links to access that information. A friendly reminder that this is not medical or legal advice. This is just information. Consult a professional for your own personal situation. I ask that God would bless you with the wisdom, the courage, and the strength that you need as you're navigating this caregiving journey. And I want to remind you, you are not alone. I appreciate you joining us today. And until next time, stay strong, and I hope to see you at the Care Table.